How to use misoprostol alone for an abortion with pills in the first 13 weeks of pregnancy. Every day, people all around the world have safe medical abortions using misoprostol. When the instructions are followed properly, 84 to 93% will have a successful abortion. But remember, this information is useful for an abortion with pills in pregnancies that are below 13 weeks, counted from the first day of your last menstrual period. Before starting, follow these guidelines. Verify the number of weeks of pregnancy to be sure you are below 13 weeks. Try to schedule your abortion when you do not have any other activities and you can rest. Although complications are rare, it is important to have somebody with you and a plan of action in case of an emergency. Think about self-care. Stay hydrated, eat a meal, drink some tea, use a hot compress or have a hot shower to soothe any cramping, and have pain medication ready, such as ibuprofen. Do everything that makes you comfortable during your regular period. Medical conditions that are contraindications. Medical abortions below 13 weeks of pregnancy are very safe for the majority of people. But if you have certain medical conditions, it is not recommended to use abortion pills. Misoprostol is not recommended if you are using anticoagulants such as heparin and warfarin. You are allergic to misoprostol or prostaglandins. You have been diagnosed with an ectopic pregnancy. This requires specific treatment, and you should seek medical care. If you have an IUD, you can still use the abortion pills, but it does require some precautions because cramping is likely to be more intense, and an IUD increases the risk of having an ectopic pregnancy. So whenever possible, it is safer to have the IUD removed prior to using the abortion pills. Abortion pills and dosage. You will need 12 misoprostol pills of 200 micrograms each. If it is difficult to obtain 12 pills, you can choose to proceed with only 8 pills of misoprostol, but the effectiveness will be reduced, especially if you are between 10 to 13 weeks pregnant. 200 micrograms of misoprostol is the most common dosage, but if the pills you are getting have different dosages of micrograms, you will need to recalculate the total number of pills so you can use the correct amount of medicine. The procedure. Step 1. Painkiller. Take 800 milligrams of ibuprofen or an alternative pain medicine about 30 minutes before using misoprostol. This step is not required, but it is highly recommended because ibuprofen will reduce the intensity of the cramps and help you manage the possible side effects of misoprostol. If you are allergic to ibuprofen, you can take other medicines like acetaminophen or paracetamol, 1,000 milligrams. If you have anti-nausea medicine, you can use it at this time too. Wait 30 minutes. Step 2. Misoprostol. Misoprostol is used differently from other medicines. This video will show you how to use it by placing it under your tongue, sublingual. If you want to learn about other ways to use misoprostol, please contact our counseling team for instructions. Place 4 misoprostol pills of 200 micrograms each underneath your tongue. The pills must remain there for 30 minutes in order to be absorbed into your system. You can swallow your saliva, but don't eat or drink during these 30 minutes. After 30 minutes, you can drink some water and swallow what's left of the pills. If you experience vomiting during the 30 minutes that you have the 4 misoprostol pills under your tongue, it is likely that the pills will not work. This means you will need to repeat Step 2 with a new dose of 4 misoprostol pills. Wait 3 hours. Step 3. Second dose of misoprostol. Repeat Step 2 and place another 4 misoprostol pills of 200 micrograms each under your tongue for 30 minutes. After 30 minutes, you can drink some water and swallow what's left of the pills. Wait 3 hours. Step 4. Third dose of misoprostol. Repeat Step 2 and place another 4 misoprostol pills of 200 micrograms each under your tongue for 30 minutes. After 30 minutes, you can drink some water and swallow what's left of the pills. Bleeding and cramping typically begin within 4 to 6 hours, but they may start as soon as 30 minutes after taking misoprostol, or it could take up to 24 hours to begin. If you don't experience any bleeding or cramping within 24 hours of your first misoprostol dose, please get in touch with us. It is possible and safe to repeat the procedure if needed. Expected symptoms. You will know that the abortion has started when you experience cramping and abundant bleeding that is similar or heavier than your regular period, accompanied by the expulsion of blood clots and tissue, which can be different sizes depending on how far along the pregnancy was, and similar odor and color as your regular period. The duration of heavy bleeding and the intensity of the cramps varies from person to person. You can continue to take pain medicine throughout the abortion process. Do not exceed the recommended dosage per day, and do not use regular aspirin as it may increase the risk of hemorrhage. You can also use a hot compress on your stomach or warm drinks to alleviate the cramping. Side effects. Misoprostol can cause diarrhea, nausea, vomiting, dizziness, stomachache, headache, fever, and chills. These side effects are normal and temporary and should disappear in the next 24 hours or less. Warning signs. When to seek help. It is important to pay attention to your body and how you feel throughout the entire process. Although not common, there are some warning signs that require immediate medical attention. If you fill 2 or more pads in 1 hour or less, and this lasts for 2 consecutive hours or more. If you have a fever of 38 degrees Celsius or 100.4 degrees Fahrenheit or more that starts in the next 24 hours after using the last dose of misoprostol and does not go down after taking ibuprofen. Always confirm with a thermometer. If you experience severe pain that does not get better after taking pain medication like ibuprofen. If you feel very sick or the color and/or smell of your blood is very different from your regular period. Blood can smell unpleasant, and it can be brown, dark, or bright red. But if you have a discharge of another color that smells rotten, it may be an infection. If you have redness or itchiness, or your hands, neck, and face are swollen, it is likely that you are having an allergic reaction to the medication. In this case, you can use an antihistamine, but if you find it difficult to breathe, then the allergic reaction is very serious and you need medical care immediately. Remember, if you need to seek medical attention, you do not have to say that you used abortion pills to induce an abortion, as the pills are not detectable if you have used them under your tongue. Post-abortion care. Having an abortion with pills takes around 15 days to complete. It is normal to experience bleeding for several days after taking the pills, but symptoms should continue to decrease. It's okay if the bleeding stops and starts, and it can continue until your next period, which often happens within 4 to 6 weeks. It is not mandatory to get an ultrasound after an abortion. If you want to confirm that the abortion was successful, you will need to wait 2 weeks to do an ultrasound and 4 to 5 weeks to do a blood or urine test to make sure the results are accurate. Taking a test sooner may give a false positive result. In the weeks following the abortion, take these precautions. Using pads is recommended to monitor your bleeding during the first few days of the abortion, but then you can switch to tampons or a cup as soon as you are comfortable. You can return to your normal activities, exercise, work, etc., as soon as you feel ready. It's completely normal to experience a range of emotions after an abortion. You might feel relieved, calm, and happy, or you might feel sadness, grief, or a mix of different feelings. Some people start to feel better right away, while others might need more time. If you're struggling, talking with someone you trust can offer support and comfort. There is no evidence for a recommended amount of time you must wait to have sex after using the abortion pills. You can have sex whenever you are ready. The most important thing is to listen to your body and desire. Your menstrual cycle may return in approximately 4 to 6 weeks. Your fertility can return very quickly, which means you can get pregnant if you have unprotected sex very shortly after your abortion, within as little as 2 weeks. If you wish to prevent an unwanted pregnancy, it is recommended that you start a contraceptive method right away. If you have any questions at all, please get in touch with our counselors by email at info@safe2choose.org or by live chat on safe2choose.org. You can also find us on social media at Safe2Choose. We are here to support you.